Hi, I'm Dr. Faranak Kamangar, and welcome to the Future of Dermatology Podcast. We're here to talk about the real science behind skin, the medical breakthroughs, the cosmetic innovations, and everything in between. We are back with Dr. Tina Bhutani, CEO of Synergy Dermatology in San Francisco, an associate clinical professor at UCSF, and previous co-director of the UCSF Psoriasis Center. And the topic of today's episode was actually in her title, because those were a lot of really cool roles, and we want to learn, and this episode is not just for residents or early career, it's really for everyone navigating your career in dermatology. Yeah. We want to learn, how did you do all of that? So you are the top at everything. You are psoriasis and inflammatory skin, just huge key opinion leader. We learned so much from you. You headed or co-directed with Dr. Liao, the UCSF Psoriasis Center, clinical trials, phototherapy, pivoted to this extremely successful, large private practice, not because sometimes people go into like a little thing and you're like, I'm just going to jump in. You don't just go from one huge thing to a small thing. You went from huge to huge, but different, I'm sure.
Very different.
In many ways. So I would love to hear about this giant move that you made. And I think I saw, is it 1 year?
It's been a year. I know.
How
it's crazy.
is that
like time
possible?
This year just kind of flew by.
Oh my gosh.
But yeah, it's been a year since I went into private practice.
Well, congrats on
Thank
the
you.
1 year landmark. So yeah, I literally have 5 questions that I put in Claude. I said, Dr. Tina Bhutani is coming on the podcast, and I wrote all the amazing things you said. And I said, what are the 5 top things I should ask her? So I'm going to get to those. But do you want to start with just what has it been like and what led to, all of it. Tell us everything.
Well, what has it been like? It's been really fun. I think it's been a new challenge, right? It's doing something different is very exciting sometimes, and learning new skills can be really, really exciting. So that part of it has been awesome. There's definitely been challenging times. There's been really rewarding times, but overall, I just feel like I've grown so much this last year, both in my leadership skills, my business skills, dermatology, because now I'm doing kind of, more general dermatology in addition to just psoriasis and atopic dermatitis. And so, I just feel like I'm growing in many, many different ways.
No, that's amazing to see. And it's also just really great for others and me and everyone to kind of hear, like you can give yourself permission to do that, right? Like sometimes you find yourself like pigeonholed in this one thing, and then it's almost like this whole thing to become, even though we're all dermatologists to an outside person, they're like, wait, what's the difference? But within our world,
there's very different categories of dermatologists.
So much weight on the category and then switching a category, but really sometimes in life you have to experience one life, you have to experience all these kind of different things.
Yeah, I always tell, a lot of time residents will ask me when they're graduating, like academics or private practice, which one should I do? And I say, like, you pick what's right for you right now, but don't have this like giant pressure that this has to be the career that you're going to be in for the rest of your life, right? Like you might get into it 3 years and say, hey, that was great, but now I want to try something else. And that's okay. Like you can go and do something else. It took me a little longer, but at the same time, I say in every other industry, people jump around jobs all the time, but I don't know why in medicine, it seems like a bigger deal than it really needs to be.
It seems like such a big deal. And I wonder, what is that? I mean, there's obviously like the logistics. It's not going to be as easy, but then it's also not that hard, right? You can get re-credentialed within 3 to 6 months. There's many doctors that are credentialed with multiple practice settings. So in theory, we give ourselves these things like, well, it's harder to shift, but it's doable. There's pathways to it.
I think it's almost excuses. Like we almost like make excuses for ourselves. We make the process harder than it needs to be. Yeah. And I think because we're so analytical as doctors, we like have to weigh every pro and con, and we have to make these lists, and we have to know that we're making the perfect decision. But sometimes decisions are never perfect. Yeah,
it's really true, because I think our intuition's telling us something. And there's a certain point where you're like, maybe this has been a great experience. Like you want to, what is it? Is it Marie Kondo that she does like it's served you, get handed back.
Does it bring you joy?
Does it bring you joy? And then to some extent you're like, maybe I should go over there and see if I want to do that. And your intuition is telling you that. Yes. But then our analytical minds, I don't know, we're just like that. Yeah. And probably dermatologists maybe are more so, because we're like this like small subset of people that have done this crazy path.
Yeah.
But
you like overcomplicate a simple thing.
Exactly.
And then the fear is always, because I have the fear all the time, but then you look at like every dermatology practice is always successful and every dermatology practice has a 6-month wait.
Yeah, it's true.
What is this fear of like failure if you go to like this other thing? So I think it's just, I mean, we could go over all the details, the differences, the settings, but I think the mindset piece is really interesting.
Yeah, I know. I would love to study that more at some point, and like how we think about things and how it's different than, other people, because I do think it's different.
It is. We need Dr. Koo.
Yes.
Actually, let's find Dr. Koo.
He needs to
psychoanalyze this. He will figure it out. But then going back to the logistics, so like what major changes, or would you say it's like 80-90% the same, dermatology, or is it very different between the different settings?
I think, my setup when I was at UCSF was kind of a hybrid between research and clinical, and now I've moved into predominantly clinical.
Yeah.
So for me, I think it was probably more of a shift. It was a bigger change than if you were just doing clinical work at an academic center. If you were seeing patients, multiple days a week, and then, doing that in a different setting, then it probably wouldn't be that much of a change. But for me, it was a little bit more of a change because I was kind of going predominantly research to predominantly clinical.
Yeah, that's true. So a different makeup of your day.
Yeah, totally.
And it's probably going off a tangent here, but if you were to try to kind of emulate that in private, is it a little bit harder to get clinical trials going in private?
I'm getting closer to that point of being able to think about bringing back clinical trials.
Yeah.
So, but I don't think it's going to be, because I think, one of the challenges that I had at UCSF, and I think is a challenge at many academic centers, is all the layers of bureaucracy that you have to go to, for example, get a clinical trial off the ground, or get a study IRB approved, or get a contract approved by lawyers, things like that. Yeah. And in private practice, you still have to do those things, but it's you don't have to go through all the layers of complexity. Yeah. And so from what I've heard from others around me that are doing research in private practice, that sometimes that startup piece is actually a little bit easier.
Almost could be simpler.
Yeah, exactly. Now, I think it might be harder to get the trials, because you don't have the label of like a UCSF physician,
which you do.
Yes, exactly. I had that luxury. But if somebody else was in private practice,
if you're just going out starting a private practice to make that name.
How do you market yourself as, I'm doing research and bring your trials to me? I think it might take a little bit more effort. Yeah.
So would you say, there's multiple pathways you could do, but is there value for clinical, we're talking about specifically about the clinical research route.
Okay.
If you're going clinical research, should you spend some time at an academic center? And there's multiple ways, and there's probably examples of people we can think of who've done it both ways. But are you better off being mentored by colleagues and kind of starting out more in an academic, kind of center, then kind of branching off and having that name recognition and all of that? So.
Totally. I can only speak to my own career, but I don't think I would have changed anything. I think everything worked out the way it was supposed to. I started at an academic center where, again, I got that mentorship. I had that community. I had the infrastructure. I had the resources in order to be able to do research. And that kind of, put me on the path. And then once again, once I felt like confident enough, or I felt like I knew the process enough, then I was able to kind of take off on my own. Yeah. But so I wouldn't have changed my pathway. And I do, again, when I'm talking to residents and mentoring them, I do tell them, like, if you have an inkling, like, even if there's a little part of you that wants to do research, it's probably good to start in academics, because I do think you learn a lot through the people that have done it before you. Yeah. And so I think that would, not be a bad place to start.
So as we're talking through it, and I've never actually sat there and really analyzed why we fear these stages and things, but I almost wonder if we have the classic medical training, and then you have your classic residency, and it's really defined. But by the time you're a third-year resident, you're done with residency. Yeah. You've learned everything you can in that setting. You leave it very happy, and you love everyone that's given you everything they have, but you need to go to a different setting. I almost feel like if these different stages of even your career are similar, there's only so much that learning and opportunity at a place, and then there's a point where you can't grow past. Yeah. It's probably I don't know. Maybe it's not the same thing, but I wonder if you kept someone up being a third-year resident. Yeah. 3 years past when they want it to be. It's probably not the best analogy, but there are times where you want to do more, and maybe a different setting will give you that.
I do think, though, it's very personality specific. So for myself, for example, I am very motivated by growth. I love to grow things. I have a growth mindset. I can't sit still for longer than a little while. But I know a lot of people who are perfectly content with just doing the same thing every day and just, keeping it at the same level and not thinking about that growth. They're just totally happy with what they are. So I think it's very personality specific. I think me and you might be unique personalities.
Yes, we're thinking about our mindsets, but that doesn't explain, everyone. You're right. And maybe like growth is different for other people.
Yes.
Like maybe they're like, okay, so this is good. I got the career down and now
I can focus on family.
Really
or I
want to,
I
want to explore
hobby.
my,
I can learn how to paint.
Yeah, hobby. What is that? Hobbies. But it's true. Yeah. I mean, like they're kind of fulfilling that in a different place. But you're right. I think we're similar in that way. So we're like, well, obviously this is the thing. But if you're constantly growing and innovating, you will at some point outgrow a certain. If the structure is fixed.
If you've done it right.
If it's a structure, it's fixed. Yeah. And larger corporations, same as where I am, it is fixed. And it has to be fixed because you can't manage thousands of physicians if you're trying to going at different levels. Things. Yeah, everybody has to kind of beat to the same drum kind of thing. Yeah. The bigger organizations get. It's like that. So at some point you have to kind of go maybe a layer smaller. And I know our pharmaceutical colleagues say the same things. There's like big pharma, then there's medium pharma, then there's, and you can only innovate so much at kind of different levels. So you haven't gone all the way to like a tiny practice. You actually went straight into like a kind of a large practice. How did you find that? I mean, it was probably a good thing. Maybe you would have been too bored if you went all the way to like just you have multiple staff and phototherapy and like
I think it was pros and cons. I mean, I was very lucky to kind of fall in and take over a practice that was already running, that was already functioning, and so I think in many ways I sped up the pathway to running a successful private practice because it was already successful, and I kind of just had to come in there and take over. But at the same time, a lot of the things in the private practice were not choices that I had made or decisions that I had made, and now I was trying to do things in a way that somebody else had set up. And so it was easier, but also more challenging at the same time. Same thing with staff, like I inherited, the whole staff and the whole practice running, but some of these staff members were not people that I had hired, so we found, that maybe we didn't work as well together as we thought we were going to work. And so there's a lot of nuances into that. But I do think, again, I shaved off a lot of years. I know I hats off to the people that start practices from scratch. I mean, I know a lot of people that do it. I know a lot of people that are doing it right now, and it's hard. It's hard.
To do like every single piece by itself, even just like
even every decision, like what exam table do I buy? What autoclave do I buy? All these things where you don't think about it walking into something that's already set up for you. But there's gets down to like every little decision that you make.
It's down to you. And then the bigger thing is too, a lot of times when we're leaving a bigger group, you are leaving this bigger negotiated rate. How did you find that? Or was that something that the practice had already kind of figured out what insurance companies to partner with, and that made it a little bit easier?
Right, exactly. So again, I was taking over an infrastructure that was already built for me, and so again, it made it a little bit easier. I did start taking a few other plans that we weren't taking before, but for the most part, and I think, again, if you're a medical dermatology in private practice, and if you are seeing insurance pay patients, cash pay is a different beast. But if you're taking insurance, you're probably taking most insurances, because again, you want to bring in, you don't want to pigeonhole yourself into like, we only take this insurance and then patients calling and then you have to kind of send them somewhere else, right? So you try to diversify as much as you can and take as many plans as you can. But when I started off, there's some plans that like, we're not taking any more dermatologists. We have plenty. Wow. We have a wait list, things like that. And so it's not as easy. It's not like you can just walk in and say, here I am, I want to be part of your insurance plan. It doesn't work that way. If they already have enough dermatologists in your network, they might not need you.
That actually sounds crazy. Because you feel like it's derm. It's a subspecialty. And you should have more.
And like you said, like everybody has like 6-month wait lists. Like you should need more dermatologists.
Derm. So that's always like a whole interesting thing. And let me take a look at my LLM generated questions here. If they're not good, we can skip them.
Okay.
What's been the most unexpectedly delightful part of running your own practice that you never experienced in academics? I feel like that could be controversial. Should we skip that one? No. Well, I don't know. What is it delightful?
I think for me, to be honest, so patients, at UCSF, when they initially came to to UCSF. They were coming for UCSF dermatology, right?
Yeah.
Which is a world-class
Yes.
institution,
Yeah,
right?
of
They're
course, yeah.
coming for the best dermatology care. When patients come to see me now, they're coming to see me.
And they're coming for the best in dermatology care.
No, but I mean, it really is a really nice feeling, because a lot of times they heard about me from a friend, or their husband came and saw me last week and he had a great experience, so now the wife is coming in, or, it's more of like a community-based practice.
Yes,
and so it's really rewarding to get those personal referrals. So for me, that's been the most delightful piece of it. I was like, oh, you actually want to come see me?
That's true.
It's like,
that is
and sometimes they don't
different.
even have a problem. They're just like there for a skin check.
Because
so
they know that.
they're going to get good care. They're going to build a
great
relationship.
dermatologist in the community and just want to come, like, establish care. So that is amazing.
For me, I think that's been the nicest.
That is beautiful.
Part of it,
and it is unique for a private practice kind of community setting. Second question, if you could design the perfect dermatology practice of the future, unlimited budget, any technology you want, what would it look like? I like that question. Well, let me tell you.
I know. I think that's a question for you.
What would that look like?
No, I think there are a lot of things in dermatology that we could automate.
Yeah.
And again, I think this gets back to our
with DermGPT.
inability.
I know you're about to say that. But sorry, go on. Yes.
Plug for DermGPT.
Yes.
No.
I knew that was the next sentence.
I think it gets back to our ability to make change.
Yeah.
I think as doctors, we're used to doing the same thing the same way over and over again. And in order to make us change something, it takes a lot of work and a lot of effort, right?
Yeah.
And I think there's a lot of companies out there that are already starting to do this, but like automating certain things that could, decrease a staff member in your office or kind of bring down your overhead and, things like that. So I think we need to be open to those opportunities as long as it doesn't sacrifice patient care, right?
Yes.
That's the most important thing.
Yeah.
And as long as you don't lose that personal touch, which the patients, again, they're coming to see you, you don't want to lose that trust.
Right.
Yeah.
No, it's true. Yeah. I mean, there's so much that can be done, but changing human behaviors is very hard.
Yes.
Next one, what's one piece of technology? Well, I guess that's the same. Should we skip that?
Okay.
Well, or is there one that you're excited about? Is there like one piece that you're really excited about?
Your
electronic health record, right?
Yeah, my EMR system's pretty awesome. No, I think like AI-based scribes. I haven't had the luxury of using one yet, but I've heard from a lot of people where it's like, it's listening to the conversation and filtering out like the small talk and only, including the relevant information into a note, things like that. I think that is the way of the future, and I think that's going to be really cool.
No, I totally agree. And I just noticed these are like very technology focused. Is it just because this is going off my searches?
It's going over your searches. Like, yeah, exactly.
What technology
it knows its
do you
audience.
like?
It knows its audience.
Yeah, it's like this is just geared towards me because these are questions I want to know. Next, how has your day-to-day routine changed, and what do you love most about your new schedule and workflow?
Yeah. I think, again, like I mentioned, I went from predominantly doing research where in some ways you kind of, make your own schedule. In some ways you have to have a lot of discipline because you have to like build in time to write grants and, fill out applications and mentor and, do all of these things. But in many ways, you can build your own schedule to doing predominantly clinical work where now it's, I can't really make my own schedule. It's kind of set up for me. I could in many ways, but at the same time, it's like you got to be in clinic. You got to be there.
Patient,
exactly.
You should probably be there by 8:30.
By
8.
But I think the most surprising thing for me is, I used to, in many ways, when I was more research focused, my clinic days, not to sound mean, but like they were kind of a drag because it was time that I was taking away from my research.
Right.
And I would always be like, oh man, if I had an extra half day, I could finish this grant or I could do this or I could do that. And so it always felt like clinic time was actually hindering my research. Yeah. And now that I'm actually just doing clinic, and for now, I mean, obviously the research will come back, but for now the research part has been taken off the table. It kind of brought back the joy to seeing patients. Like I realized I actually do love clinic, and it doesn't seem hard. It doesn't seem like long days. I get to meet these people. I get to know about them. I get to socialize, day to day. So I think it's just, what made it hard was trying to do too many things at once. Yes. But now that I've kind of filtered it down to just doing one thing, it actually doesn't feel as burdensome anymore.
And that's actually interesting to know because you were talking about the same experience, right? Like patient care in a clinical setting, but just changing the setting brought back the joy versus, it's really interesting to kind of think about this, because some people say, okay, I'm burnt out of clinical practice and I'm going to leave, but maybe you're not.
But you might just be burnt out in this one setting.
That one setting. So that's a really good point too.
Exactly.
And the last question, we'll just see if it's good enough though. It's probably technology related. If you could give one piece of advice to dermatology residents who are trying to decide between academic medicine, private practice, what would it be? That's a tough one.
Yeah. I mean, I think I already said it. I say, like, go with what feels right in that moment and what you think is going to be the greatest interest of you, but don't make it such a big pressured, highly pressured decision, and don't make it feel like you can't change, right? So like reevaluate every 3 years, 2 or 3 years, sit down and actually be honest with yourself and like, what do I like? What am I not liking? What do I want to change? What would I want to do differently? And then do it, you know, just don't sit and like ruminate on it. So just make the change.
I love it. No, thank you so much for that. And I think the biggest takeaway was, because in a lot of career panels, it's this setting versus this setting. And the biggest takeaway here is it's not about the setting. Listen to your intuition. It's okay to change. You're not rejecting the previous setting.
No, not at all.
You took all the amazing things, the learnings. Most of us also keep in touch with every setting we leave. Like I'm still going back to UC Davis where I did my residency all the time to see the residents and things like that. So it's okay to live in these like different ecosystems. And then the other takeaway is dermatologists usually succeed. You know, depending on the fear level probably has to be removed. So
the chances are you're
probably going to be okay. Well, thank you so much for this. This was so fascinating just to see the journey. I can't believe it's been almost a year, because when you were making the move, we're like, we need to sit down for a podcast. And a year later, we were able to do it.
Here we are.
So thank you again.
Thank you.
Thanks for joining us today on the Future of Dermatology podcast. If you enjoyed learning about the science behind skin, make sure to subscribe, and we'll see you next time. As a reminder, this podcast is for educational purposes only, not for medical advice. Always consult your healthcare provider.